Hi, my name is Coach Donovan. I'm actually a board certified health and wellness coach, and today we're going to talk about men's health in the workplace. A corporate advantage HR can lead. So, this is a strategic guide for HR professionals ready to close the gap between men's health needs and workplace well being outcomes. The hidden cost, men avoiding care. According to the Cleveland Clinic, avoidance is the norm, not the exception. These numbers represent real people on your payroll. 44% skip their annual physicals and the checkups. 44% neglect mental health. Mental well-being is consistently deprioritized by men. 49% maintain a poor diet. Almost half report not keeping a consistently healthy diet. So why it happens and why HR feels it. Men are statistically less likely to recognize symptoms, acknowledge their risks, or actively use health services. This isn't a personal failing, it is a deeply conditioned behavioral pattern. What are the stakes for HR? It's more than just benefits. It's about performance and retention. Men's health isn't just a wellness checkbox. When men are healthier, the organizational impact is measurable across every dimension HR tracks. Higher engagement, you're going to get lower absenteeism, greater productivity, and less turnover. Men's health isn't just one program, it's a mind-body system. Men often avoid help for mental health and social support quietly, suffering in silence while remaining present at work in body but not in spirit. Treating physical and mental health as separate programs in your organization misses the full picture. That's why it's key to have integrated support as the main path to meaningful, lasting employee well-being. That's why silence isn't safety. Stigma and reluctance are powerful forces that drive men away from seeking help, often until a crisis point. HR's role is to systematically dismantle those barriers before they become business risks. There's the stigma barrier. Many men equate seeking help with weakness. That's why making culture change is a prerequisite for program success. The access barrier, time, cost, and awareness. These are gaps that prevent men from using benefits that already exist. But here's HR's leverage. There's strategic intervention, policy, communication, and champions within your organization will create measurable reductions in those barriers. We need engagement design that works for men. Make the healthy choice the easy choice. Environment shapes behavior. Design the workplace so healthy decisions require the least friction. Have options like healthy food in cafeterias and vending machines. Walking meetings and standing desks as the defaults. Dedicated break and relaxation spaces on site. Even with all of that, the most critical part, based on what we discussed before with the barriers, we need to build a male champion network. Peer influence is one of the most effective drivers of behavioral change among men. Identify respected male voices across departments to A, model behaviors that are healthy openly, share personal stories and that normalize help seeking, and then spread adoption organically, team by team. This is critical. If you can get the C-suite involved, that is the most important because nothing really happens if it's not coming from the top down. So that's critical. And then there's communications. Who needs to hear what first? A one-size-fits-all message rarely moves men to act. Strategic segmentation and channel choice significantly improve response rates. So segment by gender. Collect and analyze participation data by gender to pinpoint specific gaps in your men's health strategy and tailor messaging accordingly. Go multi-channel. Email, posters, manager briefings, and digital platforms each reach different segments. Diversify to maximize coverage across your workplace. workforce. Reach the household. For male-heavy workforces, consider direct mail to spouses and their family who frequently influence their healthcare decisions. These are the get it done policy moves HR can own. Number one, pay time for preventative care. Cover time during work hours for annual physicals, screenings, and health surveys. This will eliminate the no time barrier. Exercise is work time. Allow and encourage physical activity breaks. On-site fitness or subsidized gym access reinforces that health is a priority, not a perk in your organization. Mental health normalization. Clearly communicate employee assistance programs, the virtual options and on-site mental health pathways that are available to your employees. Leadership modeling is non-negotiable for culture change. This is critical. Good mental health is a significant reduction in business risk. Call to action, okay, launch a men's health plan in 90 days. You don't need a perfect program to start. You need a deliberate 90-day pilot with clear metrics and honest feedback loops. Day 1 to 30 is the audit. Use gender-specific feedback and participation data to identify your biggest barriers to men's engagement and success. So check with them, ask them questions, right? Days 31 to 60, pilot. Launch easy access, paid time, mental health, de-stigma approaches, male champions as a coordinated initiative with clear ownership. So find your male champions, get this stuff together, get the C-level buy-in, critical. Don't have to always have that, but it's important. I mean, I think if you start with a small group and do a proof of concept, that could also be a great sell point towards the C-suite. Days 61 to 90, measure, track engagement rates, absenteeism trends, and retention signals. Use the data to scale what works and refine what does not. So HR professionals who lead this initiative don't just improve health outcomes. They build a kind of workplace that attracts and retains top talent. And your talent is diverse. Your talent has different needs. You need to address them. Okay, are you ready to lead the charge? It's time to empower your male employees to tap into their full potential and embrace a proactive approach to well-being. So my Awaken the Man Within Warrior program does just that. This groundbreaking book offers a comprehensive guide for men to regain their resiliency, cultivate purpose, and conquer their workplace challenges in a quick 8 weeks. It's very fast, very effective. It's an identity-based approach. So we are not looking at quick fixes. We are looking at creating long-term habits. First step, order your book today. If you have any questions, set up a free consultation. Look forward to seeing you on the inside.